Well, I'm here today with Nadine. Nadine has worked with us at Hay Clinic now over the last 2 years in our internship program, has done an outstanding job. Now officially going to Duke for PA school. We're very proud of her. And so Nadine finally actually got in to watch a surgery today. And I can gladly tell you that she did not faint. You did great.
Thank you.
So, Nadine, what were the main take homes from what you learned in the OR today?
Yeah, today at the OR, I really was able to witness in person Dr. Hayes' safety checklist and how important it is, and also how he is when he's speaking to everybody in the OR, looking them in the eye, very direct, clear communication, no raising the voices or anything like that. It's calm, and always you cultivated a culture in the OR that everybody can speak up. I'm just amazed at all the people and how they all work together and how every person has a little part. And I was really amazed with every time the neuromonitoring person would read baseline, he would repeat it back, that read back, just ensuring that you're confirming that you understood what she said. And so I think really seeing your attention to detail, and I was even amazed when you got on the floor just to make sure everything was okay. You are very dedicated. It can seem, I think, from an outsider like you're being nitpicky, but it's because you want to ensure the safety to the maximum of your ability. And so I'm sure patients, parents, even the hospital system should appreciate that, because you are covering all the bases. It's more work, it's extra time, but it's definitely worth it. And I was very glad that I was able to see it, kind of being on this side of end of things and seeing it on that side. It gives you a good full picture. And Doctor, you're just very skillful. Just watching you do your thing, and I was
Get into my zone.
you get into your zone
Into
and
my flow.
your technique, from the way that you hold your instruments, your foot under the. It was just. It's clear that you have thought through things. You're very focused. Don't take your eye away from what you're looking at. You're just careful, and I think you're skillful. You're careful, and you're very talented. And it was.
How was the morale in the room?
Oh, it was good. Everybody was happy to be there. It was calm, and I think
Why do you think that is? Why do you think people seemed happy and like to be there?
I think it's because when you're organized, I think you're organized. You also respect them. I think that's very evident that you respect them and you respect what they're there to do.
Yeah.
And I think even when there's a conflict or even just a miscommunication, you're there to help just kind of flesh it out and talk it through. Yeah, how do we fix it? What can we do next time? And I think that was, no one left, even when there's something that went wrong, or nothing necessarily wrong, but something that could have been better.
Yeah.
We didn't leave everybody was we left off with something that we can improve on.
Right.
And so I think it was a good experience, and I was very happy that I was able to see it.
Well, you did a great job in there. I look forward to seeing all the things that you've learned. Yeah. Remember, whenever you shadow with Dr. Hay, you got to learn at least 30 things. If not, the grade is F. And then I'll call Duke and I'll say, nope, sorry, she can't start. She got an F. But you think you came up with 30 things you learned?
Oh, probably close to 100.
That's good. Well, Nadine, we really are so thankful for your time serving here, and glad you were able to finish on a great note.
Yeah.
And you got to spread the good news about teamwork, standard work, because standard work works.
That's right.
All right, Nadine, thanks so much.